Today is Valentine's Day, and it's common to celebrate with a little something sweet, but too much could impact your heart health. Something important to keep an eye on year-round is your A1C. There's a powerhouse test for it that many of us should be getting done, that many of us maybe don't know about. Our 9 News medical expert, Dr. Kohli, joins us this morning. Thank you for coming in.
Good morning. Happy Valentine's.
You too. So this is done with a simple blood test, right?
It's a simple blood test, Corey, and it can tell us so much. And I'm so glad we're talking about it because many of us don't know that it even exists out there, and yet we should all be checking our own A1Cs. So it can diagnose pre-diabetes, meaning a warning from your body that it's going to progress to diabetes if you don't do something different in your diet or exercise. Of course, it can diagnose diabetes, which can often be asymptomatic. So in the early stages, our body won't tell us that we're diabetic. It's just doing all the damage kind of silently. And then even if you're diabetic, it can actually help to sort of monitor your treatment and blood sugar levels over time.
It's so interesting because I don't really know a lot about A1C. It is a blood sugar thing, but you don't usually think about like a blood sugar diabetes thing affecting heart health, and it absolutely does.
Yeah, in fact, some experts are saying that it may be one of the most important markers of risk, more so even than cholesterol and other such markers. Because if you think about what's happening in your blood vessels when you're diabetic, there's all this excess sugar swimming around. And that sugar is going and getting stuck in the walls of the arteries where it creates inflammation. So it makes the walls of the arteries really sticky. So even a tiny amount of cholesterol can then go and get stuck, which then causes more inflammation, causes blockages. So those of us that have prediabetes or diabetes, that's actually a huge wake-up call. And some even consider it a heart attack equivalent to have diabetes. And this test will tell you your blood sugar over the last 2 to 3 months.
Oh, wow.
So it's your average blood sugar, not a snapshot in time, but really what your body has been seeing, because it's how much blood sugar got stuck to your red blood cells. So the higher the number, the more blood sugar you have swimming around.
Well, and it's better that way too, because often if you go in like, did I fast? Did I not fast? Did I fast long enough?
Right.
You know, if you just so happen to have a donut the night before, then it could throw it off. So this is a span of time.
That's right, and it's a non-fasting test, so it's really easy to get. You can get at any point, and you can't say, oh, I ate that candy bar, or I had a big meal yesterday, and that's the reason it's high, because it's your body's average. It's how much the body's been seeing. Now, if you're pre-diabetic or diabetic, and this number is elevated, the good news there is that you can often reverse things.
Okay.
And so that's why this number that may not speak out to you is something we should all really be getting checked.
Why are we hearing more about A1C lately?
Well, 2 reasons. One is because I think over the years, the cardiology community has really realized this is a heart attack equivalent. Yeah. Sugar is much more important than we realized. And this is a really modifiable risk factor early. And the second is because it's started to go up. We're getting more diabetic than we were ever before because we're eating unhealthy, we're gaining weight, we're more sedentary than ever. So if you look at the trends, more of us are getting diabetes than we've had before. In fact, I have a number of 30, 40-year-old young patients that have type 2 diabetes very early in their life, which means that their kind of blood vessels are getting stickier and stickier by the day. By the time they're in their 50s and 60s, they're just a setup for having a heart attack or stroke.
Wow. All right. Real quick, last question, because they did just tell me that we're out of time, but how can people get this test? Just at the doctor's office?
Yeah, you can get it yourself. It's a direct order. The labs that order it yourself, or you can ask your doctor to order it. And anyone over the age of 45 should be getting it. And anyone under 45 who has risk factors, obesity, family history, should be getting it.
Check that A1C. Dr. Kohli, thank you so much for coming in. Happy Valentine's Day.
Thank you.